Before receiving the Rsvpref3 Antigen-As01e Adjuvant, PF, 120 mcg/0.5 ml IM suspension, kit vaccine, make sure to read all the information provided by your healthcare professional. If you have any questions, don't hesitate to ask them. The vaccine is administered through an injection into a muscle in the upper arm by a healthcare professional. After receiving the Rsvpref3 Antigen-As01e Adjuvant, PF, 120 mcg/0.5 ml IM suspension, kit, you may experience some side effects such as soreness, redness, swelling, or bruising at the injection site. You may also have muscle aches, joint pain, headache, or tiredness. If any of these effects persist or worsen, it's important to inform your healthcare professional promptly. In rare cases, some people may experience symptoms like fainting, dizziness, changes in vision, or ringing in the ears immediately after receiving the vaccine injection. If you experience any of these symptoms, it's important to seek medical attention right away. Sitting or lying down may help, as these symptoms usually do not last long. It's important to remember that this medication has been prescribed to you because your healthcare professional has determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. While a severe allergic reaction to this drug is rare, it's crucial to seek immediate medical help if you notice symptoms such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of potential side effects, so if you notice any other effects not listed, it's important to contact your healthcare professional for medical advice. If you are in the US, you can report side effects to the Vaccine Adverse Event Reporting System, VAERS, at 1-800-822-7967. In Canada, you may call the Vaccine Safety Section at Public Health Agency of Canada at 1-866-844-0018. Before getting the Rsvpref3 Antigen-As01e Adjuvant, PF, 120 mcg/0.5 ml IM suspension, kit vaccine, make sure to let your healthcare professional know if you have any allergies to vaccines or any other allergies. This vaccine may contain inactive ingredients that could cause allergic reactions, so it's important to talk to your healthcare professional about any concerns. You should also inform your healthcare professional about your medical history, especially if you have a current fever or illness, or if you have any immune system disorders. If you are pregnant, your healthcare professional may recommend the RSV vaccination, so it's important to discuss the risks and benefits with them. If you are breastfeeding, it's not known if this vaccine passes into breast milk, so it's best to consult your healthcare professional before receiving the vaccine. Always follow your healthcare professional's advice and recommendations for the best timing and dosage for this vaccine. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your healthcare professional. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. Rsvpref3 Antigen-As01e Adjuvant, PF, 120 mcg/0.5 ml IM suspension, kit is a vaccine used to prevent respiratory syncytial virus, RSV, in children. It helps to stimulate the immune system to protect against RSV infection. The vaccine is administered as an injection into the muscle. The recommended dosage and schedule will be determined by a healthcare professional. It is important to follow their instructions carefully. The best time to take this vaccine is before the RSV season begins, typically in the fall. It is important to discuss the benefits and risks of this vaccine with a healthcare professional before receiving it. Make sure to schedule and attend all of your medical and laboratory appointments as recommended by your healthcare provider. This will ensure that you are receiving the proper care and monitoring for your condition. Rsvpref3 Antigen-As01e Adjuvant, PF, 120 mcg/0.5 ml IM suspension, kit is a vaccine used to prevent respiratory syncytial virus, RSV, in children. It helps to stimulate the immune system to protect against RSV infection. The vaccine is administered as an injection into the muscle. The recommended dosage and schedule will be determined by a healthcare professional. It is important to follow their instructions carefully. The best time to take this vaccine is before the RSV season begins, typically in the fall. It is important to discuss the benefits and risks of this vaccine with a healthcare professional before receiving it. Remember to store this medication in the refrigerator, but don't freeze it, and keep it away from light, children, and pets. When you no longer need it or it expires, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.